So the goal of Ayurveda is to extend both lifespan and health span. So, and for that, especially what Ayurveda is concerned with is health at in your old age, for which you have to lay the foundation when you are young. Just the other day, I was reading how alcohol affects your brain. Like, for example, if you were to have 2 beers a day, your brain volume is going to shrink in such a way that you lose 10 years of your life. With the brain degeneration that happens due to overconsumption of alcohol is that, I mean, this is what you will see in old age. Your brain will reduce in volume, but that can happen 10 years earlier. So there are many, many such influences which, if we control and regulate, we can enter into old age with better health. This is called today as successful aging. Have you heard of that concept? Successful aging. Successful aging is that you enter into old age without major cognitive decline or major physical, disabilities, which today is becoming more and more common. Yes. Yeah. Yes. True. The thing is, the same thing is told about French people also. They drink a lot of wine and they eat a lot of cheese. Still, scientists have been surprised to find that the incidence of cardiovascular disease is very less in the French population compared to. That is true. But, in terms of alcohol increasing the risk of brain damage, now there is a unanimous understanding, which is why the WHO has come up with a blanket statement that no amount of alcohol is safe. So there are other factors, like Germans may have certain other innate genetics or their lifestyle, which is, minimizing the damage done by alcohol. But in spite of all that, the fact that alcohol increases your risk or reduces your overall lifespan still holds good. So they may be living for 80, 90. Even in India, there are people who drink alcohol. And even in my family, I know some of my elders, they lived into their 90s. But it still means that their overall lifespan has been reduced by 10, 15 years. They could have lived longer. So overall risk, it is increasing. So it is not that 90 is the end of life. I mean, actually, we can live even longer. I mean, there are people who live beyond 100. In fact, in the Sushruta Samhita, I was very intrigued by a statement in the text that when you are doing dead body dissection, Sushruta says, Avarsha Shatikam, means don't take a body which is more than 100 years old for dissection, because the organs will be not very clear. You won't be able to study it properly. Now, this set me thinking, why should Sushruta say, today would anybody tell that don't take a body that is more than 100 years old? Because you will never get a body that is more than 100 years old. So at least it shows that at Sushruta's time, people were living more than 100 years. And that is why the medical school, I mean, the surgical school, the students may find it difficult to get a body that was younger, on which they could do dissection properly. So it is very much possible that we can live longer. This is the whole goal of Ayurveda. It's also called the science of longevity. So extending your lifespan along with health span. And there, actually, Ayurveda has been a little moderate on alcohol. We have always recommended that in moderate quantities it is okay. But today, science has come with a more greater warning that has happened in the last 1 or 2 decades, this knowledge and information developing. And now the concern is that it increases the risk of many types of cancers, many fold. So when you say it increases the risk, it doesn't mean that you will definitely get it. But compared to without alcohol, your chances would be very high. And when you look at a large population, the effects are very pronounced. A lot of people would suffer. It would have been nice if we could predict who will not be affected much by alcohol and who will be affected more. In fact, Prakriti gives you some such indication. If you are Vata or Pitta, you will be affected more by alcohol. If you are Kapha, you will be able to tolerate alcohol much better. So these may be the differences. Then your diet, the way you are drinking, according to Ayurveda, if you drink too much on empty stomach, dry liquor, then the effect will be more pronounced. Whereas if you drink in small quantities after a meal, not completely on empty stomach, then you can minimize the bad effects of alcohol. So many such factors are there, but it doesn't negate the basic understanding that alcohol is unsafe, and that is definitely abuse. There is no safe. Yeah, it is very difficult. What I have found is that it's very difficult to get people out of substance abuse, whichever system it is, because that is the kind of damage that it does to your whole system. You become so dependent, it completely changes your psychological disposition. It's really a rut. You just cannot come out of it. And those people who manage to come out of it, it takes a lot of effort. And you need a very supportive family, we need a very supportive society, you need so many you need a real ecosystem to bring them out of, and that is not available in our society today. So what Ayurveda says, it's all about, it's very tamasic and rajasic. Tamasic is what causes that addiction, and rajasic make you to repeat that behavior. And so you are, from Ayurvedic point of view, are under the deadly grip of rajas and tamas, and a complete elimination of sattva guna. You can see those people have a particular kind of character. They have no hesitation in committing crimes. They have no hesitation in, all their inhibitions are completely broken. So from that state of mind, rehabilitating the person is very challenging. There are attempts going on. We have Ayurveda based de-addiction centers also. Even from alcohol, it is sometimes very difficult to bring back people. So prevention is definitely, in my opinion, now we should give more emphasis on prevention rather than. But having said that, with extraordinary efforts, a lot of people are being rehabilitated also. It's not easy. Even mental illness, it's very difficult. Today, what we have is, when you are mentally really sick, we have a system that will try to protect the society from that mentally sick person, but not really rehabilitate him back into society. You have these mental asylums where you can put these sick people and they'll be on strong medications, on shock therapy and things like that, so that they don't harm people around them. That is the only thing. And most of these modern drugs are also very powerful, strong, addictive, with side effects. We do not have a system. From Ayurvedic point of view, to help a person who's mentally ill, the healer needs tremendous compassion. So it is only at that level that you can relate to a mentally sick person. If you want a response from a mentally sick person, the healer should be extremely compassionate. So, like for example, Buddha and Angulimala, the encounter. I'm sure many of you have heard of this story. So he was, Angulimala was killing people and taking their fingers and making the garland. According to one version of the story, he had 999 fingers and he was waiting for the 1000th finger when Gautama Buddha crossed his path. And Angulimala was in jubilation. He ran and confronted Buddha and wanted to kill him. But he was taken aback by Buddha's stature, that he was not at all disturbed in any way, very calm. And then Buddha told him, "Go ahead, kill me." And that kind of startled Angulimal. He had never seen a person like this. And when they had eye to eye contact. I mean, Buddha's compassionate gaze, it is said, completely transformed Angulimal in a moment. And so these kind of stories are there in our Puranas. You know the story of Valmiki also. He was a very terrific hunter, and he looted and killed people. But just because of an encounter with the seven sages, his personality was completely transformed. So today we do not have, in psychology, in psychiatry, actually, there is no lesson on compassion. There is no cultivation of compassion. We do not have compassionate healers. So we are not able to deal with mental health problems. This is a big challenge. So now what I want to discuss here today is how can Ayurveda today contribute to healthcare? What new paradigms will it bring? I want to also highlight that, as Nomeshji was mentioning yesterday, we have to think of innovation. Get You look at Ayurveda as a system of ideas and paradigms and principles that will give us new avenues for modern research. And in the coming slides, I'll also show some examples. Like why all of you, I mean, you're studying at the IIT, very professional advanced courses. Why should you get exposed to IKS systems? So these are a rich collection of ideas, of paradigms, which give you direction of new thinking, new thoughts. It's not that all you have to use them as it is there in these texts. They could fuel, new ways of thinking. And when you combine it with technology, maybe new discoveries can be made. And so you should look at it in that way, in an open way. Uh, so there are few things that Ayurveda, I felt, can really contribute if you bring Ayurveda into mainstream healthcare. One is that nature-centered approach to medicine. So we are talking about person-centric approach, but before Ayurveda is person-centric, it is nature-centric. We believe that if nature is healthy, then only we can be healthy. So healing nature is one of the first interventions that Ayurveda is talking about, keeping our environment clean, keeping, balancing the climate cycles. So one of the things Ayurveda is always concerned about is introducing you to the seasons, because the seasons is an index to how nature is functioning. And I don't know if you have heard of Rutu Samhara. It's a beautiful poem by Kalidasa. So there are some controversies as to whether it is by the original Kalidasa, but still it's a poetic, masterpiece, where the six seasons are described in such a beautiful manner. So when it is, I mean, fascinating to experience life when the seasons come in their full, expression, and every year becomes, much more a matter of celebration when the season. Today we see the seasons are not expressing completely. This in Ayurveda is called as Rutu Vyapat. Rutu Vyapat means it is a failure of the climate which leads to abnormal manifestations of the seasons. We had in Ayurveda the concept of Ritucharya, which we will discuss today, where we have the concept of Ritu Sandhi. Ritu Sandhi means junction of two seasons. And there is a particular way we have to live during that period as you transition from one season to the other. So, have you heard the word Muhurtam? So it is coming from the Sanskrit Muhur Ritam. Muhur means again, Ritam means the rhythm in nature itself. So Muhurtam means tuning into the rhythm of nature again and again. Muhur Ritam, Muhur Ritam. So today we think about Muhurtam basically maybe for marriage or some auspicious function. But Ayurveda said that Muhurtam is for everything. Every moment has to be a Muhurtam. Means you're realigning yourself with the nature around you. And that is how Ayurveda establishes health. So it's a nature centric approach. This is something which we may find very challenging today because we live in complete disconnect with nature. We are not at all conscious about what is happening outside. We have all our interiors air conditioned and controlled climatic conditions. So we are living in a very different kind of situation. But the second thing is, of course, person centric. So three things are there in Ayurveda. One is regionality, which is also being lost today. Like if you are in Delhi, you have to behave, you have to have a culture like a Delhiite. That identity you have to, uh, you know, take upon yourself so that you can adapt to the local conditions. This is a very important. So whenever you move from one place to another, immediately you must have a protocol. How do you adjust to that place? This is called the regional or localized approach in Ayurveda. The second thing is seasonality. Even if you are in that region, you have to keep adjusting yourself according to the seasons. And the third thing is personal, making things personalized. So regionalization, seasonalization, and personalization. All the three things are there. So regional and seasonal comes in nature-centric approach. So eating the fruits that are provided by nature during different seasons, eating local kind of foods, which will be more in tune with the climate and geography of that. Now, person-centric we already discussed yesterday. Then the third thing in Ayurveda is that Shakyate annamatrena narakartum niramayam. This is a statement from from a very old textbook, 3000 years ago. They discovered that Shakyate annamatrena, just with anna or food, it is possible. It's possible to make a person healthy just with diet. So we call the diet and lifestyle as pathyam. So this is a very important concept in Ayurveda. Today we are going to unnecessary medication. So we say healthcare has become medicalized, which means that any interaction with a medical professional results in a prescription and the intake of swallowing of some pills. In fact, we feel that if the doctor doesn't prescribe something, he has not treated me. This is a big challenge. So majority of the time you don't need medication. So we have to minimize medication. So Ayurveda brings that paradigm of giving more importance to lifestyle and diet and medicine as a support. So the more you correct diet, lifestyle and diet, the less you will need medications. The less you correct lifestyle and diet, the more strong medicines you will have to take. And the stronger medicines you take, the more damage it does to your system. So, of course, when there is an emergency or a crisis, we have to start with medications. But then gradually we should go back to diet and lifestyle. But in other conditions, you can even start with diet and lifestyle. In early stages of hypertension, diabetes, cardiovascular disease, kidney disease, so a lot of these diseases that we are facing today, careful modification of diet and lifestyle can bring you very good changes rather than strong medications. So I'm not saying that medicines cannot be. So what Ayurveda, see, medicine we consider like a seed. Ayurvedic medicines are not so strong like modern medicines. Please keep that in mind. They don't work without diet and lifestyle. It's like you need, if you, there is a soil, you have to plow the soil, prepare it, and then put the seed, right? If you put the seed somewhere, it will not grow. There are some medicines like the banyan tree, it will grow on your terrace also. Modern medicines are like that. It will work in any system. But sometimes many medicines don't work. Have you heard of the placebo effect? Placebo effect is even if you give a sham medicine, some people have strong belief in that, it will work. But you've heard of the nocebo effect? Yes? Nocebo effect is just the opposite. If you don't believe in a medicine, it will not work. In fact, medicines that have been proven by clinical trials have found to not working in people who strongly believe. So you may have a habit of reading side effects about medicine sometimes. And studies have shown that if you strongly expect a side effect to happen, then it will happen. So These things show that the mind influences. In fact, when I was in the US once, an integrative medicine conference, a psychiatrist made a very nice presentation on placebo as an ethical alternative. He was saying that it's high time placebo was now accepted as legal medicine. Why? Because there is no other medicine or substance that has been so much researched as like a placebo. Because in every clinical trial, there is a placebo. So, you look at the data of how many times a placebo has been tested, it is the most studied medicine in the world. And what is interesting is most of the times the placebo has shown a better effect than the medicine it was being compared to. So he is arguing that why don't we include placebo as a medicine and try other medicines only if the placebo doesn't give you enough results. And do you know that blue placebos work better as sleeping pills? Red placebos work better as painkillers. There's nothing in it. But if you have pain, I give you a blue pill, it will not work as well as if I give you a red pill. Yeah, that's the psychology. If a red pill, they think, oh, they have found that when people are given a red pill, it works better as a painkiller. If you are given a blue pill, it works better as a sleeping pill. Now, if you put on the label 1000 mg instead of 250 mg, then that placebo will work better. And if you make a placebo very expensive, it works better. Now, one study showed that even though you told the patient it is a placebo, it still worked. And the patients came back asking for more placebo. So, this shows that your human mind has a lot of role to influence healing. This is what Ayurveda had believed right from the beginning. So, bringing the patient into your confidence, activating, but not denying medicine. So, that is another extreme. I don't believe in pray and heal yourself. You have to do your treatments. You have to be very watchful. All these elements are needed. So, this is mind body medicine. Ayurveda gives you a very interesting perspective. What Ayurveda says is there is a shloka in the Charaka Samhita Manasaha Arthanukulyadhi Tushtirurja Balodaya Sukhopapogadachasya Vyadhes Chato Balakshay. What will happen with a placebo? Vyadhehe Balakshaya. Vyadhi means disease. Balakshaya means the disease becomes weaker when you have a placebo effect. It doesn't cure the disease. So Ayurveda believed that the placebo only will make the disease a little mild so that your medicines can now work more easily. It creates a healing environment, a healing response in your system. According to Ayurveda, placebo alone is not always enough. But if there is a placebo, then treatment becomes much more easier. The modern medicine is trying to eliminate the placebo effect, but even they cannot do it because a physician itself is the best placebo or nocebo. Because you go to some physicians, you get the feeling, I will never get better. And then you will never get better. With some physicians, the moment you have the consultation, you feel that you are going to get better. So, this is mind body medicine. The next thing in Ayurveda is, Ayurveda accepts herbal, animal, chemical, all sources. Many people think that Ayurveda means vegetarian. Ayurveda never went to any extremes. It says all it's a madhyama marga. Ayurveda says sarva dharmeshu madhyama. Always follow the middle path. Don't go to any extreme. So veganism, carnivorism, vegetarianism, no isms in Ayurveda. Ayurveda is saying be flexible. Be flexible and use whatever is necessary to support your system in a dharmic way. So we talk about kama himsa and dharma himsa. Yesterday we talked about kama, right? Kama means sensory gratification. Want to be happy? In fact, if there is no kama, life would be so boring, right? Every day morning. See, kama here just means sensory gratification. So, every day, whatever we are doing, studying, learning, it's ultimately with the hope that with whatever resources you manage to get in your life, you can fulfill your karmas. So this is what we call as artha and kama. Now to regulate that artha and kama, we have dharma. So if you regulate artha and kama with dharma, then you will get moksha. This is what Purushartha says. Because if you regulate it, if you just wait a little before you indulge in that kama, your mind will slowly balance itself. And one day you will find your mind has got balance. I don't need karma anymore. I'm happy. I'm happy from inside. So this is the Purushartha pathway. So Purushartha doesn't, our lifestyle doesn't say you shouldn't enjoy in life. It only says enjoy with the resources you make. So while you're making your resources, you have to wait, right? You will say, okay, let me finish my course. When I get a salary, I will really, enjoy. But by that effort that you take, you have to wait for a few years before you make all that money. Otherwise, what you will do, you will rob and steal and try to fulfill your karma. So when you are in the path of dharma, what happens is there is a constraint, and that constraint tempers your mind. And by tempering over a period of years, if we lead that life according to this Purushartha, then eventually your mind will become free from that cravings. And that state is what we call as moksha. Moksha only means freedom. Freedom from what? Freedom from your own thoughts and desires. So that is the healthy path that Ayurveda is prescribing. So here we take, so why I mentioned that was what we say in Ayurveda say when you eat, can you eat meat? Yes, of course. Jivo jivasya jivanam. One life form is food for another life. Ahastani sahastanam, apadani chatushpadam, bhalguni tatra mahatam, jivo jivasya jivanam. One life is food for another. Those without hands will be eaten by those with hands. Those without legs will be eaten by those with legs. The small will be eaten by the big. This is the law of life. So nobody can prevent you from eating non-vegetarian. But then Ayurveda says, make sure, himsa, without himsa you cannot live in this world. Ahimsa is not practical actually. Because when you breathe, you are killing so much of microorganisms. For your life, you are sacrificing. So the whole idea is how to balance this. So Ayurveda says, just ask yourself, is when you are eating meat, is it for just karma or is it for your nutrition? If you are killing and eating just for the fun of it, then this is called karma himsa. This will create imbalances in nature. Most of the today's non-vegetarian food is just for enjoyment. Because the way you are cooking it, the way you are, it is not at all nutritious. In fact, it is harmful. The way we are eating non-vegetarian food is actually has nothing to do with your health. It is only for entertainment. So that is Ayurveda calls it as kama himsa. In fact, if you cook meat in a healthy way, majority of us may not want it anymore. Am I right? So we say that as long as you are doing kama himsa, then you should avoid. And another thing is, are you aware? Plants, recent studies have shown that plants may also be feeling pain. They are emitting some ultrasonic sounds. So it was done on potato and tomato plants. When you go and cut their stems, they are shrieking loudly. This can be captured, ultrasonic sound. So how can you say that eating plants is ahimsa? Eating anything is himsa. So, we have, so the only thing is in this world, we are only taking in everything from nature. So try to give back as much as you can. You can never compensate for what you are taking. So try to give more than what you are taking, but still the deficit will be only on our side. So with this awareness, if we live our life, so Ayurveda says we can use herbal, animal, chemical, everything. But we have to combine. What Ayurveda is a science of molecular combinatorics. See, Ayurvedic medicines are molecular cocktails. And based on the science of molecular combinatorics, we balance Like, for example, piperine and curcumin, two things are there. Most of our food in ancient times, we used to mix turmeric and pepper together. Now, turmeric has a compound called curcumin, which your body cannot absorb. So, how much ever healthy you take, you will just color your intestines and it will all go out. Nothing is going to get inside. But if you add a little pepper to turmeric, the curcumin bioavailability will increase by 2000 times. Now the body is able to absorb the curcumin. These are synergistic actions. So Ayurveda brings before us a science of complex formulations. So I strongly think that if you learn from Ayurveda, if you study the way Ayurvedic drugs are combined, we may be able to create. Already modern medicine is going towards molecular cocktails, combining two, three. But in Ayurveda, like if you take some of our formulations, there are 50 herbs in that, 60 herbs. Each herb has 100, 200, 300 chemicals. So don't think Ayurvedic medicines are not chemical. In fact, it is full of chemicals, much more chemicals than modern medicine. Modern medicine is one chemical. Ayurveda is thousands of chemicals. So that is why we have to be careful also when you use it. So most of the time we combine like amla, buttermilk, vitamin C. See, these vitamin C will enhance your iron absorption. Amla will also enhance iron absorption because it has got a lot of vitamin C. Buttermilk will enhance iron absorption. So we combined, buttermilk in certain foods which have iron sources. If you add buttermilk and cook it, then the iron will get better absorbed in the system. So they knew these kinds of combination. And actually, we have not fully understood. So this is a big area for new modern research. How we combine things, how to create the right combinations. We could work on dietetics, we could work in pharmacology, what do you call pharma industry, and develop a lot of new insights. This could bring a completely new science of pharmacology to the world. So that is a very strong area that Ayurveda can contribute. And then preventive and predictive medicine, catching the disease, in a very early stage. And then healthy aging. So these are at least some of the, if in at least if we in India, we take Ayurveda, bring modern scientists and modern doctors together, look at the Ayurvedic knowledge, prioritize in these areas some new areas for research. I think in the next 100 years, India may lead the globe in health research. That much potential is there. So nature centric, I'm not person centric, lifestyle, diet, and medicine, mind, body, medicine. So I already gave the explanation, so I'm not. So Ayurveda also talks about treating body, mind, and self together, and we have three modalities of healing. So Yukti Vyapashraya is kind of rational healing, which is for the body. Daiva Vyapashraya is all ritualistic, sometimes religious healing is for the mind. Now, so Ayurveda believes that the patient's belief system should be taken into consideration. If you are too rational with a patient, he may not heal. Depends on that person's mindset. If they have a religious belief, accept it. Allow them to express that also because it will aid their healing. This is called as Daiva Vyapashraya. And then you have Sattvavjaya, those who are spiritual. They have that willpower, and many you can see people with the same disease like cancer. Some people have stronger willpower and they survive. So that is Sattvavajaya. So beyond medicine, there is always the belief system and the mental inner willpower of the patient. So Ayurveda gives you a framework to use all the three together. Today we dismiss religion saying it is unscientific. What Ayurveda says is don't do that. If you belong to a certain religion, if you have to respect their religious preferences, their cultural, preferences. And if you don't accommodate that, they may not heal. I mean, the whole healing will become a big, pressure for them. It will become a big stress for them. You can see a very practical approach in bringing all these things together. So this is some idea about how Ayurveda looks at health. Now we'll quickly review how Ayurveda looks at diseases. See, in Ayurveda, disease is a crime in progress. So, an Ayurvedic physician is like a Sherlock Holmes. In actually, a detective goes to the crime scene after it is committed. So, a murder has already happened. And now the detective is trying to see what are the clues available and how you can catch the murderer. But medicine, that is for forensic department, this kind of investigation. A medical doctor has to catch the culprit before he commits the crime. So a patient is coming to you with a disease, which means he's telling you that a crime is happening in my body. I don't know the criminal, who it is. So he's coming to a doctor, and the doctor oh, rat. We need a Ganesha here to catch the rat. In now, just be watchful. It's a small rat. Okay, so shall we continue? So disease is a crime in progress. So what an Ayurvedic physician does is, when the patient comes, you ask the patient to speak first. This is our principle. Allow the patient to explain what they are going through. Now this has got a way. This is called darshana. Darshana, sparshana, and prashna. Darshana means inspect the patient, palpate, then start asking questions. Allow the patient to explain what they are. A lot of time, what happens is doctors don't allow patients to speak. Now, this can create a lot of tension in the patient's mind. So, from Ayurvedic perspective, allow the patient to explain allow them to unburden themselves. They have come to a doctor with a lot of concern, lot of fear, and if you don't, mostly what doctors will say, that's okay. Let me find out what's wrong with you. I know better than you. Now this is not good. So of course, don't make the patient talk too much. That's also a problem. And don't let the patient diagnose the disease for you. That you have to be watchful there. You must negotiate. So just allow the patient to tell what is it that you are actually, what is it that bothers you much. This is very important. What is bothering the patient more may have not really may not have anything to do with actually the seriousness of the disease also. For some people, it's just the pain. Because what bothers you when a disease bothers you only, you will see a doctor. Ayurveda is telling us to go from that state to start watching your body. Like if you are not sweating at all, it's not a good sign. Of course, it's convenient if you don't sweat. Then you don't need perfumes, you don't need to have a bath. So it's very convenient. But it's very harmful because sweating is the way your body regulates. One of the ways to check even before a disease comes, watch. So your urine should be as clear as possible. If it is getting dark, it's a sign that you are dehydrated. So maintaining a strong. So many people ask, how much water should you drink? Because that is very variable. What I have learned from my experiences, drink enough water, watch your urine, make your urine maintained at a straw colored consistency. That means then you are hydrated. Another way to just check whether you are having enough hydration is to watch your lips. So lip lips give you a clear indication of your status of hydration. If it is becoming very dry, then it is up. Are you digesting your food? So many small things are there which you can watch every day, and then you won't allow a crime to happen in your system. It is like having a surveillance. Now, how do we prevent crime? By having a surveillance system. The cameras are there. You are looking for any untoward signs. So much before a burglar or a murderer can enter into your area, you will be able to catch it. That is the kind of surveillance system that Ayurveda wants every one of us to enforce, so that you don't allow anything to happen. But today, what happens? All barriers are breached. And even when the crime has started, still you are saying, it's not bothering me as of now. The murderer is eating from your fridge. You are saying, what's the problem? He's not attacking me, but he's just waiting to have his lunch. After that, he will start his work. So, this is how disease comes into our system, and we are quiet until the point it begins to really bother you. By the time it's already too late. So, Ayurveda gives you a framework. So, disease is called as Vyadhi. According to Ayurveda, it is an outcome of the imbalance in dosha, dhatus, and malas. But you can identify imbalance is only a pre disease state. So, the body is in imbalance means it is susceptible to disease. But the sad part is imbalance, even if we identify, we will not do anything about it because it's not bothering me. So, why should I be worried? Body gives you small, small signs, dryness of something or some difficulty, bowel disturbance, but you will not bother. So eventually that imbalance will become a disease. So especially in Ayurveda, Agni is a very important thing. When your gut health is disturbed, it has a profound impact on all your systems. As we say, gut brain, gut heart, gut lungs, all this axis is there. So when your microbiome is disturbed, your digestion is disturbed, body will not get the proper nutrition, your immune system cannot be overhauled. So I'm trying to make it very simple. Imbalance to disease. First state is imbalance. Then from that imbalance comes disease. But when we experience, we think the disease came out of the blue. We don't understand that there's a long, like a disease like cancer, even for it to become visible in your system, it takes about 10, 12 years. It may take 20, 30 years before cancer. So there's a 30-year history. So you had all the time in the world. If we are vigilant, cancer is one of the diseases which we can very easily, eliminate, catch at a very early stage because it has such a long, progression. Even heart disease doesn't happen in a day. Today, modern science medicine has found out markers. There is a marker called homocysteine. So if homocysteine levels and then HSCRP, high sensitivity CRP, and then you can look at what is called as endothelial dysfunction. This happens in your blood vessels 10 years before you get heart disease. So you have now a prediction window of about 10 years with biomarkers. So a lot of diseases are, it is possible to, and Ayurveda is giving you that map. So according to Ayurveda, what is the ultimate cause of disease? We say is pratnya. Pratnya means intelligence, aparadha means violation. It means because we are fools, we are getting disease. To get disease is something foolish, according to. Because if we live intelligently, there's no way we can be sick. There is a book, Healthy at 100. You can Google it, Healthy as 100. A very interesting book to read where the gerontologist has explored societies where people live full 100 years without diseases. And he found that there are many societies where cancer is unheard of, heart disease is unheard. In India, there is a place called the Hunza Valley. It is in the Indus Valley region, presently in Pakistan. The Hunza Valley people, they don't have, the majority of the diseases that affect us, they don't have. In fact, they like to be, if you ask them their age, they will tell at least 10, 15 years more than what they are. Whereas what we do, we would like to reduce at least 10 years. And we celebrate youthhood, which according to them is the most immature, most unstable phase of your life. They look at old people because they have a very long old age. They celebrate old age. So if you ask their children, so the gerontologist writes there, the children are asking the parents, when will I also become old? Whereas all old people are today trying to find out when can I become more young or will I be young again? So this is the difference. So the next thing is out of these three things, one is beyond our control. It's called parinama because disease is caused by time. As you age, eventually your body breaks down. But you can slow that process if your pratnya is working correctly by leading a healthy lifestyle, diet. And another thing is asatmendriya artha samyoga, which is very pronounced in our digital age. Overexposure to digital media, overexposure to sound, overexposure to all your sense organs. You have to optimize the interaction between the sense organs and the sense objects. Otherwise, it can cause disturbance in your system. So, these are, according to Ayurveda, ultimate causes. But then Ayurveda also talks about different types of causes. I'll go through this very quickly just to show you how granular the whole concept is. Ayurveda says some causes are sannikrishta or immediate. The moment you get exposed, you will get a disease. Can you give an example? Food poison. The moment the exposure comes, you will get a disease. There, it's very easy to identify. Do you know, just today I was reading, I think it was in Netherlands or somewhere, somebody just drank 2 mouthfuls of coconut water, tender coconut water, and in a few hours he was declared brain dead and passed away. You read about that? So it's just come in the news. So what has happened? That person kept the coconut. It was actually opened, and it was lying in his home for I think about a month or so. And inadvertently, he just sipped that coconut water and immediately realized that it is bad. He spit it out, but maybe 1 or 2 gulps inside. And even as he was explaining to his wife that, I did this is not good, he collapsed. And on autopsy, they found the brain had swelled up. So this is called a Sannikrishta Nida. So coconut water should be taken very fresh. If you have sliced it, then you have to keep it in refrigeration. And you have to be also careful about. There was another discussion which I read about coconut water. A cardiologist in Bengaluru, he threw up a debate when he said, in Bangalore, coconut water costs 60 rupees. If you are going to hydrate yourself with just coconut water every day, it's going to be quite expensive. So the cardiologist said, just take plain water and plantains, and you won't need any coconut water. So this created a lot of opposition on internet because there were so many coconut water lovers and they started opposing. But the fact is, it is true that coconut water, if you have coconut farms in your home and you can afford to pull down a coconut every day, then it is fine. Coconut water has some electrolytes also, but most of the time we don't need it. Even Ayurveda says water, plain good water, is good enough to keep you hydrated. And fruits like plantain also give you a lot of these electrolytes. Like plantains have a lot of potassium. So you take plantains regularly, you can even keep your blood pressure, at bay. So these kind of things are there. We need to be really having a balanced outlook. But this does not mean coconut water is really an amazing nature's drink. But another why I mentioned it was a lot of commercial coconut oil come with a lot of additives. So it may not really be healthy at all. So it's good to remember that plain, clean water is the best way to hydrate yourself. Honey is good, especially the best kind of honey is coming now from New Zealand called Manuka honey. So that has got, so honey is not one thing. When I was in Russia, that is when my eyes opened. I saw honey and a shop full of honeys actually. And each one of them was looking different: yellow, white, brown, different flavors. So it's very difficult to give a blanket statement about honey. There are some honeys which are extremely medicinal. Generally, honey is good, uh, you know, It is according to Ayurveda, it can reduce kapha in your system. It's good, especially for infections, wounds, and it is as a nutritional supplement in small quantity. It is good. True. So that is the thing. The quality is very much compromised. Today we are, yes, that is a problem. In all these things, in a commercial world, when you try to distribute in large quantities, the quality is compromised. So most of the things are not what they are supposed to be today. Milk, honey, oil, everything is adulterated. So that's another story altogether. But some honey, especially this honey is good for, it's good to have some honey around in your home, even for first aid. If you have burns, if you apply honey, it prevents it from scalding. Honey is good in infections. Especially Manuka honey has a very good antibiotic property. I mean, it can heal wounds. Some surgeons have tried on resistant wounds also, which don't respond to antibiotics. So they have medicinal properties. According to Ayurveda, we should not heat honey too much because it leads to the production of a certain chemical which is carcinogenic and can be damaging. But mildly warming honey is not so harmful. It's only when you heat it too much. Too much of heating oils also leads to production of harmful compounds which are carcinogenic. Then there are some causes which are viprakrishta, which is producing a result much later. Like for example, alcohol. It may not immediately. There are some immediate effects if you overdose, but in small quantities it may enhance your risk of cancer or liver disease maybe after many years. So this is called as viprakrishta. Then there is vyabhijari hetu. Sometimes it may cause a disease, sometimes it may not. So you can also put alcohol sometimes in that. In some people it may cause, some people it may not cause. Now, COVID virus is also a Vyabhichari Hetu because it doesn't cause COVID in everybody. Then we have Pradhana Hetu. Like, for example, there are many things that may be causing a condition, like hyperacidity may be caused by stress, it may be caused by. So, I just wanted to show you how Ayurveda differentiated all this. I mean, even in those days, they were looking very minutely into the cause effect relationships. Now, we would say very spicy, pungent food is one of the main reasons for hyperacidity. Others can also be contributed. So, we differentiate pradhana and apradhana hetu. So here is a very interesting classification of Sushruta. It's very comprehensive. Sushruta says diseases can be caused through by multiple reasons. So, sorry, the first one I need to correct. And this is congenital. This is Janma Bala Pravritti. So this is quite a fascinating classification in Sushruta Samhita. Very comprehensive. It looks very modern because we classified diseases. Some are hereditary, which means they come through genetic transmission. In Ayurveda, we say it could be from the mother or the father, Matruja or Pitruja. Then we have Janma Bala Pravarta, congenital diseases that you develop in the womb. So it could come from the mother's diet or some of the factors, intrauterine conditions, which may lead to congenital deformities. Then we have dosha bala pravrita, which are caused by damage to your physiological system. Then we have sanghada bala pravrita, trauma or external cause. Then we have kala bala pravrita, seasonal diseases. Then we have daiva bala pravrita, these are acts of God, sudden epidemics. We don't know how and when it will happen. And then we have swabhava vala pravrta, or natural or inevitable. These are further classified into many. So they have differentiated congenital and hereditary. So hereditary is in the genes. Congenital is during intrauterine life. So hereditary diseases are there. We knew that diabetes, many skin diseases, piles, vitiligo, many of these things run in the families. And we talk about bija dosha, I told yesterday, bija bhaga, whatever. They had some idea of gene, chromosome, and all that. So then we have congenital deformities, maternal habits, diet, emotions during pregnancy. Diseases caused by Vata, Pitta, and Kapha further divided into endogenous and exogenous. So, by internal factors, internal breakdown, or by some external influence. So, you can see we have a very broad and comprehensive framework. Then, diseases due to trauma or accidents, fractures, wounds, sprains, those kind of things. Seasonal allergies, age related diseases. Some are constant, some are situational. Then we have Daiva Bala. Some people just when there is no explanation why somebody has become sick, then we attribute it to Daiva. A lot of time things happen just out of the blue. Everything is going on fine. I've been leading a very healthy life. I've been very righteous, religious, spiritual. So Ayurveda tells you that even if you take all the measures to be healthy, you may still fall sick sometimes. This is not the norm. Majority will be able to overcome, but some people, in spite of doing everything right, they still become sick. In such condition, we call this as Deva Bala Pravan. So they will need a lot of psychological support also. That is when spiritual therapies, because they have no other reason, they need to cling on to something to cope up with that situation. Now, this is the a very interesting aspect of the detective. What does a detective do when he sees a crime? First thing is to reconstruct the crime scene. Take all the clues and then say, here's what happens. This is my theory of how that crime was committed. Now, a physician is also expected to do the same thing. And in Ayurveda, we use a five-fold framework. This is called Panchalakshana Nidana to actually reconstruct the crime scene. So, what is that reconstruction? Nidana is the cause. Nidana means the cause of the disease. What caused the disease? See, Ayurveda is a rational system. By identifying the cause, we can look at how it produced the effect and then reverse it. So, what was the cause? What were the prodromal symptoms? Prodromal symptoms mean you may get some mild symptoms initially before a disease manifests. So, many of us, before we get a severe throat infection or fever, you will have a slight throat irritation. This may last for 2 or 3 days. And then you know, now if you have had it frequently, you know, I'm going to get a flu. So that is called as the Purva Rupa or prodromal symptom. Then the Rupa or clinical features, which is a full-blown manifestation of the disease. And how, in Ayurveda, how we do is, because it's very personalized, in the method of diagnosis itself, we arrive at a tentative diagnosis and give a test dose to the patient, whether my diagnosis is correct or not. If the patient responds to that treatment, it's called a upashaya, a positive response. Then my diagnosis is confirmed. If so, it is like giving a test dose first. All treatments start with a test dose. So you can see how systematic and because they know that sometimes you may make an error in your diagnosis. So the patient shouldn't be affected. So you try to see whether the first treatment is to confirm your diagnosis. After that, the real treatment starts. So if the response is negative, then we know that we have to work back on our diagnosis, correct the diagnosis and come back with the right treatment. So it's not a blind way of treating a patient. And once you do this, you construct the whole story. This is called samprapti. Yatha dushtena doshena yatha chanu visarpada nirvritti namayasyasav sampraptir jadirakat. So how did the disease manifest? How it started? What is your understanding? Okay, this person, now somebody has a cervical problem. See, depending on how it happened, our treatments will change. So I say, oh, here's a person who was sitting in a corporate office. The air conditioner is blowing now down his neck, and the muscles become very stiff. And that is how sitting he has damaged his cervical spine. So our treatment is going to be different for this person. Another person also comes with the same MRI image, cervical spondylosis. But in his case, how it has happened, he's riding a bike in India. All the roads are full of gutters and bumps. So what happens, by continuously riding the bike, his neck is getting compressed. And now he also has the same problem, but the path is different. So your treatment is also going to be different. So Samprapti is constructing that whole thing. When you assess a case, we have to be able to understand that whole picture. Ayurvedic physician is expected to narrate, bring that narrative. This is how it has happened. So now, so this is what is called Nidana. Factors responsible for causing disease. Pura Rupa is the first sign. Rupa is the clinical features. Upashaya is what? Positive response and negative response. Then Samprapti is the total picture. Now, based on that, we arrive at a conclusion whether the disease is curable or incurable. If it is incurable, we can only give some supportive thing. If it is curable, so unless you construct the crime scene, reconstruct it, you won't be able to make a prognosis. So prognosis is very important in Ayurveda. Ayurveda does not say that all diseases are curable. Some are easily curable, some are curable with difficulty, some are only palliable. You can only give palliative care, and in some, no treatment will work. So that we tell the patient, we are sorry, in this condition, nothing may work. And then by telling that, you can tell the patient that we can still try to do something, but it should be after disclosing that there is actually no treatment. So we are not supposed to give a false promise to any patient. So this prognosis part is very, very important in the diagnosis. So after all this assessment, the doctor comes to a conclusion whether he can actually manage that disease or not. And then it is gone. Now the next step is, so first we now we have looked behind what happened, up to this point. That is reconstructing the crime scene. Now you have to make predictions. What will the murderer or the culprit, what is he planning? What will happen in the future? That framework is called Shatkriyaka. How will the disease progress in the future? So anticipating that progress, you have to intervene. So by understanding what has happened, you plan your treatment, but you execute the treatment with an understanding of what will happen. So this, in modern medicine, we call this as natural course of a disease. So with treatment, this is how the disease will go. Without treatment, this is how it will go. So if I intervene here, this is how I can prevent it from going to the next stage. So there are 6 stages in the progression of disease. They are called Sanchaya, or accumulation, Prakopa, or aggravation, Prasara, or spreading, Sthana Samshraya, or its consolidation of the disease, then its manifestation, and then it goes to complications. So every disease progresses in these stages. In some disease, this will happen very fast. In some diseases, the first 3 stages may take a very long time. So once I do the Samprapti, I understand now where the disease is standing and how it is going to progress into the future. So majority of the disease, there is this Sanchaya is what we call as a incubation period. In modern science, we call there is a long incubation period for the disease. It's building up. All the conditions for the disease to manifest is building. But when the disease takes over, that we call as a Kopa stage. Now the disease process has got activated. Like if it is cancer, it may start in one place, but it may manifest in some other place. So there is a spreading phase. Like for example, blood cholesterol will be increasing in your system. First it is accumulating, then it reaches a critical point, crosses the normal border, then we call it as Kopa. Then what is happening? It is spreading in your system. And then it will localize in your arteries and cause a block. And then in the next stage, it will produce a heart attack or ischemic condition. And then the condition will manifest as a disease. And even then, if you don't intervene, it will lead to complications. So, Vyakti is the stage of manifestation of the disease. Full blown disease is called Vyakti. It is same as Rupa in the Panchalakshana Nidha, where you see the disease in a full blown way. So, this is only the tip of the iceberg. So, Ayurveda is giving you a framework to look back at how the disease came and look forward to how the disease is going to progress. Understand this whole process and then intervene in a very intelligent way. In a way that you make sure that you have the right treatment, you have chosen the right treatment, and then implement it with an understanding whether the disease is curable or not. So Ayurveda clearly says don't simply give medicines to patients and fool them. A good Ayurvedic physician will clearly tell you whether it is a manageable or unmanageable disease. That's considered to be a moral and ethical responsibility. So these are the 6 stages. I'm not going deep into that. So, see, this Purva Rupa is very important. In olden days, they were always looking at Purva Rupas. Purva Rupas are many diseases. Today, we are ignoring that because we have shifted from clinical symptomatology to laboratory based diagnosis. So, in Purva Rupas, lab values will be normal. So, this is a new area where we have to bring more clinical medicine. That for all the diseases that, like for example, do you know constipation is a prodromal symptom for Parkinson's disease, especially in middle-aged, old age people. If suddenly you have developed constipation and it's chronic, so constipation can be there for 10 years before you develop Parkinson's. So it's a prodromal symptom. So many diseases have such prodromal symptoms. If you are able to catch them, clinical assessment, even without laboratory tests, you may be able to predict. Now, there is a score called IDRS, Indian Diabetic Risk Score. You can just Google it. It is developed by Dr. V. Mohan from Madras Diabetic Foundation Center. It's a very simple questionnaire. If you just answer that questionnaire, no lab tests, blood tests, nothing, you will know how much risk you are at for developing diabetes. Now, these are the kinds of tools that we need to catch disease early, where a blood test is not even required. But today we have reached a point where unless it shows up in your blood test, or you will not consider it as a disease, and by the time it may already have spread and developed a lot. So in Ayurveda, we have diagnostic tools, Trivitha Pariksha, observation, palpation, interrogation. So you also you study about a disease by reading literature, that is also accepted. Then you observe yourself, you make inferences. Then there is Ashtasthana Pariksha, checking 8 parts of the body. One is Nadi, then Mutram, urine, Mala, fecus, Jihva, looking at the tongue, Shabdam, looking at the sound. If today it's possible to do sound analysis, your voice, and then you can also get, yes. Nadi is pulse. So pulse was a very, I did discuss yesterday that pulse is all about heart rate variability, and heart rate variability gives you an index to what's going on in your whole system. In those days, they identified nadi patterns and made correlations. Today we have instrumentation. So there are devices like Nadi Tarangini, which is from, I think, by an IITian who made it. Now it is used in Ayurveda institutions. There is a Russian physiologist who has made a device called Veda Pulse. It's quite advanced. It uses certain algorithms to interpret HRV and give you ideas about how your doshas are functioning. So that's quite a fascinating tool. So some research work is happening in that area. Then we have clinical observation, pulse, everything is done. Then we have what is called a Dashavidha Pariksha. Dashavidha Pariksha is check the Prakriti of the person, check the Vikriti. You distinguish between Prakriti and Prakriti is a constitution, Vikriti is the imbalance at that given point of time. So, as I told you, sometimes a person may exhibit vata symptoms. It may be only a vikriti, it may not be a prakriti. So, what's the difference? If it is a vikriti, you can easily subside. If it is prakriti, it won't easily go. You still will have that tendency even if you deal with. So, one thing an Ayurveda physician checks is to distinguish prakriti and vikriti. Then we look at each dhatu. Are your dhatu strong? Like astisara, for example. You look at your bone. Today we know bone density is a big issue. I mean, a lot of people have bone osteoporosis. So whether all the dhatus are normal, your muscle, is there muscle loss, which is very common. Sarcopenia, as it is called. As you age, you lose muscle. So even when you're doing weight loss programs, you have to be very careful because you must, your lean mass, your weight should be preserved. So some protein supplementation is very essential when you do weight loss. Otherwise, yeah, yes. Huh? Sorry, I didn't explain that. Sparsham is touch, drik is your eyes. So today we know retinal analysis, iris diagnosis, these kind of things are there. The eye is also reflecting a lot of conditions about your internal state. So eye was used as a window of how your body is functioning. Then akriti is your overall stature. So like if you have what you call as apple shaped and pear shaped, two types of obesity fat deposit is there. The apple shaped deposit is more harmful than the pear shaped. So the pear shaped adiposity is what you see in women. So this fat which is stored on your back is not as harmful as a fat that is stored in your abdomen. And this is called visceral fats. Visceral fat is known to increase inflammation. It is so fatty liver. All these things come from visceral fats. And when you're on a weight loss program, the fat that is most difficult to burn away is your visceral fat. So when you start your weight loss program, first all your water content will go, and suddenly you will find your weight is reduced. After that, your subcutaneous fat will go. Then you are at risk for losing your muscles. So you have to be very careful. You have to preserve your muscles. Then it takes a lot of effort to burn your. So today there are weighing machines which actually give you a analysis of your overall fat distribution also. And in that you can find that it's your visceral fat that refuses to go away. You can measure your so there through the impedance. They measure this through that. Okay. So then you look at samhanana or compactness of the body. This is your musculature. Today we talk about six pack, how your muscles are developed. So you will have a particular compactness of your body if your muscles are all well developed, and it shows healthy distribution of your musculature. Then we have pramana. Pramana means today we have hip waist ratio, measuring your waist, all those things will come under pramana. So these measurements, even BMI, we can consider today as a one of the pramanas or ratios or measurements, which tell you whether you are healthy or not. Then satmya. Satmya is actually today what we allergies also come in that. For some people, some things will not suit. So we check for every patient, we check what is satmya for you, what is asatmya for you. When you do the treatment, you have to make sure you don't give somebody something which is asatmya for them. Like for example, milk, is it satmya or asatmya? So sometimes our medicines may have to be given in milk. So if the patient cannot tolerate it, you cannot give it. So you look at their satmya. Then you look at their mental strength. So depending on the mental strength, even the diagnosis should be disclosed only after understanding the mental strength of the patient. This is a very important part in Ayurvedic. You have to reach out to the patient. Don't tell things to the patient that will worry them too much. So according to the mental strength, both the treatment and the whole narrative of his disease should be given. Then there are two things. We check Ahara Shakti. What is the digestive capacity? What is the state of Agni? As I told you yesterday, some drugs are metabolized fast, some are metabolized slow. So If depending on our Agni Shakti, we have to decide the dosage of the medicine. Then Vyayama Shakti. This is what we today look through what you call as TMT or treadmill test. In heart disease, you ask them to, so how long they are able to exercise without getting exhausted. Then the age. This is another part. Depending on the age, the prognosis, the dosage, all these things. So these are some of the factors that Ayurveda considers. You can see Ayurveda is focusing more on prevention, early intervention, and disease progression. There are a lot of parallels with modern medicine also. And I think if we bring both frameworks together, we'll have a much more powerful understanding of disease and create more opportunities for early interventions. So because what the key takeaway message is that most diseases require a long time to evolve. I hope you are aware that 70% of the global healthcare burden is due to lifestyle diseases. And yeah, yesterday there was some discussion about bio breaks and all that, but we didn't think about it today. No, in Ayurveda there is no distinction. It only talks about Bhuda Abhishangaja. We know that there has been some infection, but this different, they never knew about bacteria or virus. Our focus was more on the immune system, strengthening the body to face the infection, which is even today a good strategy for mild infections and many infectious diseases. Even in COVID, we know that it was more the immune system of the body that helped the patient to recover. So that is a modern discovery, and that has helped us to deal with this. At least we know that in viral diseases, there is nothing we can do except support the system. So only in bacterial infections or parasitical things that we can achieve. Then Sushruta came with a very interesting observation so many thousands of years ago. This is actually contagion, how diseases spread from one person to the. So he said close physical contact, touching the affected person, droplets exhaled in air. So just imagine 3000 years ago, they understood all these mechanisms. Sharing bed with an affected person, eating together or sharing food with affected person, sitting together closely with affected person, using clothes, ornaments, etc. All these things lead to transmission of diseases from one person to the other. So all the kind of modalities of transmission were discovered. So this is the Ayurvedic approach to disease. Do you want a break for a few minutes? Okay, very 5 minutes only. Okay, okay, that's fine. I just remembered that we mentioned about a break. So the next thing I want to talk about is daily routine. And this is where I want to mention also, how traditional knowledge can inspire new discoveries. So in 2016, this Yoshinori Oshumi from Japan was awarded the Nobel Prize for discovering autophagy. Autophagy is a kind of process in the body. It's called a self-eating, where your body recycles all the waste cellular comments. It's so all renews itself. So if you go on a 12 to 48 hours fasting, it activates the AMPK signaling pathway and turns this process called autophagy. If you fast for 2 or 3 days, it is said that you can completely renew your immune system. Now, this was something which we had realized in our tradition many thousands of years ago. In the Mahabharata, for example, there is a question, Katham Sadopavasi Syad, how can I be in a state of perpetual fasting? And the answer is not that don't eat food. The answer is that if you eat only twice a day, Sayam Pratar Manushyanam, Bhojanam Veda Nirmidam, Nandara Bhojanam Kuryad, Upavasi Tata Bhaved. You will be in a perpetual state of autophagy. So if you eat in the morning and then you eat in the evening and you don't eat anything in between and you have a long fasting window in the night, your body will be always in a state of autophagy. Now, it took a Japanese scientist to unravel the biological mechanism behind it. Now, this was an idea that is there in our tradition since centuries. So, this is where I wanted to show that if we bring science and tradition together, our Indian scientists, it could have been great if one of our Indian scientists actually, discovered this. This is a fundamental concept in Ayurveda. So it shows that we are not aware of our own, traditions, and they almost use the term sadopavasi. Sadopavasi means a person who is in perpetual fasting, and you don't have to deny food to reach that state of fasting. So there's a fed state, then there's a fasting state. If you create a window of 12 to 16 hours without food, then your body goes into the fasting state. And this is a state of self repair. Now, these things are being applied in cancer chemotherapy also. In Ayurveda, we had that you will learn about it tomorrow. It's called Lankanam. Lankanam is you put the body on a restricted diet and then it goes into a different metabolic state. The body will go into hypometabolic states. In cancer chemotherapy, this is very helpful because normal cells, when you fast the normal body, normal cells will go into a hibernation. It will go into a hypermetabolic state. But cancer cells will still be hypermetabolic. So, what will happen is when you give chemotherapy drugs, the normal cells will take less of this chemotherapy drug, cancer cells will take more of it. One of the danger of chemotherapy is that it will kill both the healthy cells as well as the cancer cells. That's it. So then we have, so the only problem is if I don't cover the portion, the quiz will be challenging. They won't be able to answer the quiz. So, go ahead. I'll try to finish as quickly as possible. So there was another Nobel Prize in 2017, Jeffrey C. Hall and Mikhail Rosbash. He talked about chronobiology, circadian rhythms. For the first time, the gene that is responsible for what you call as an internal biological clock. A lot of studies related to unraveling the biological clock was discovered by two scientists who got the Nobel Prize. I think this one was also taken away from us because this idea of biological clock is very central to Ayurvedic way of thinking. In fact, in Ayurveda, we even created a image, a model of this biological clock so many thousands of years ago. And because it is nature's clock, we named each of the phases of this clock after a goddess. So we have from 2 a.m. to 6 a.m. Saraswati Yama. We have from 6 a.m. to 10 a.m. Sri Yama, which is Lakshmi. Then we have Jeshta Yama from 10 to 2 p.m. Then Parvati Yama from 2 to 6 p.m. Then Durga Yama from 6 to 10 p.m. Kali Yama from 10 to 2 a.m. And the gunas and doshas keep fluctuating. And if you understand this movement of the biological clock, we can create a lifestyle that is perfectly in tune with nature. Now, I want to just give you a hint. For example, look at Kali Yama. This is from 10 to 2 a.m. So, Kali is a goddess who comes and cuts our heads, and takes the skull in her hand. Now, this is what happens when you sleep. As you sit, when you sleep, your head falls down. And that is why we call this is this Kali coming and cutting our head, putting you to sleep. Because Kali is coming to repair our body. From Ayurvedic point of view, you must sleep around the beginning of Kaliyam if your body should be repaired completely and be ready for next day's activity. Not sleeping in this time, especially during midnight, this is Pitta Kala, very rajasic time. So if you are awake at midnight, you will feel very alert. You must have noticed that. A lot of people burn the midnight oil, as they say, which is very unhealthy because it comes at a cost. Even though you may be able to function at that time, it is at the cost of self repair and maintenance of your system. So, if you were to even just today, I was reading about a Japanese person who has done a particular training and he's offering this training to a lot of people. You can Google and find that. He has reduced his sleep requirement to half an hour. He sleeps only for half an hour and he's in gym and he seems to be in, but the medical professionals are of the opinion that this may have long term effects. So there are people who have always tried to reduce the sleep time so that they can function. In India it was done by yogis. Yogis had tried to see if they can reduce their sleep time by meditating more so that they compensate for sleep. And most yogis say that if you must sleep the least, then make sure you sleep during Kaliyam, 10 p.m. to 2 a.m. So many yogis actually wake up at 2 a.m. But what I have understood from my research, from looking at Ayurveda and modern scientific research in sleep medicine, 7 to 9 hours of sleep is generally required for majority of us. Otherwise, we are going to have serious health problems, metabolic disorders, cancers, infections. So 7 to 9 hours covering, from the end of Durga Yama to almost the end of Saraswati Yama, you must sleep. Then you have a healthy sleep. So Saraswati Yama, as you can see, it is the time when Sattva, Guna, and Vata come together. So it gives you very high alertness and awakening. And you are supposed to wake up towards the end of Saraswati Yama in a time called Brahma Muhurta. So Brahma Muhurta is the time when nature wakes up. And so the idea is waking up along with nature. Huh? Yeah, around 4:30 is the thing. But you can be a little flexible. What I've understood is that you should be completely rested when you wake up. I did a lot of experiments myself trying to focus only on Brahma Muhurta. And I had miserable days because waking up so early and then feeling completely tired. Because unless you regulate your entire life's daily routine, you cannot really wake up at Brahma Muhurta in a refreshed state. So, what is more important is to see, like if you had a very stressful day, then you may require longer sleep. So, the bottom line is that while it is good to try and see to train yourself to wake up at Brahma Muhurta, the thing is, after you wake up, how you feel, you must feel very rested. So, today, now modern sleep medicine studies also tell you that because your sleep cycles, keep shifting from REM, NREM. When you are in very deep sleep, when you wake up, you will feel more tired. So now there are apps which will also track in what state of sleep you are and then give you an alarm that will wake you up so that you are not going to feel tired. So the problem with Brahma Muhurta alone, rigidly following it, is that you may be in the wrong state of sleep at Brahma Muhurta and then you may feel tired. I have found out through my own experimentation. But on the other hand, if you follow all the things in the Dinacharya, then you can wake up, because that the Ayurvedic logic is the whole of nature wakes up at that time. And waking up along with nature has its advantages. So now just to say, in Ayurveda, we had to finish our work by the end of Jeshta Yama. This is the most creative Yama. So all your major decisions, all that should be taken at this time, not when your mind is not very sharp and alert. Now, modern circadian rhythms, the cycle, it's not exactly matching. There are some correlations, some variations. Most of the studies on circadian rhythms have been done in the West. So it could also be because of their geographical location. Our yamas don't match with many of the European or American geographical timeline. So we need to do some studies to look at our own cycles also. And this could be a good model to start with. Now, by the end of this 2 p.m., Ayurveda says all your work should be over. 2 p.m. to 6 p.m. is relaxation. So this idea of work-life balance was there in our old, daily routine. So this is the thing, yamas. Yes. No, sleeping, day sleep is generally not recommended, except in summer. In summer, it is good. In summer, a little day sleep is allowed. And when you're sleeping, what you call as a power nap was okay. Sitting and then, dropping down for a few minutes. Sometimes those power naps can be very refreshing. But lying down and sleeping is not recommended. Long sleep during daytime is not recommended in Ayurveda. In very hot places, taking a nap in the daytime is allowed. So then we have, see, few things very quickly I will finish. Immediately on waking up, one must move the bowels. So the waste of previous digestion metabolism should be eliminated and the gut. So we don't say that the moment you wake up, we are not talking about brushing the teeth. It's actually moving your bowels because that shows how your gut is functioning. If that doesn't happen, you have to drink some water, maybe lie down and make sure your bowels move. And then you clean your teeth, mouth. Then you clear your sense organs. You apply medicine in your eyes, then your nose. And then, you know, once all your sense organs and all the cavities are all cleaned, then you do abhyanga. The next thing is to cleanse your micropores. You need to sweat. So Ayurveda advises applying oil. Applying oil is called abhyanga. Massage is called mardana or samvahana. So abhyanga is not massage. Abhyanga in Sanskrit actually means to just apply oil on it. So what happens is when you apply oil on your body, your heat loss mechanism is interfered. Otherwise, you lose heat through convection, radiation, all those four evaporation. When you put oil, heat is preserved inside. And then when you do some mild exercise, you begin to sweat. So when you sweat, all the micro waste are also removed from you. So you become ready for the next day's activities. And then you have a bath. And then you are supposed to have food and then tend to your daily activities. So food, really according to Ayurveda, there are two times you can eat food. One is between the kapha and pitta kala. A lot of people wrongly say that Ayurveda says that the biggest meal should be in the afternoon. That is not true. But most of us would require 3 meals today. So many options are there. So if you are going to have a lunch, then you should have an early breakfast. If you're not going to have lunch, you can delay your breakfast a little and then you can have 2 meals a day. Ideally, if you are leading a stress-free, healthy life, you will require only 2 meals. But because we are going through a lot of stress, our energy requirements are more. So people need to feed themselves more today. So this is something which is very personalized. So don't just because somebody says intermittent fasting, everybody shouldn't try that. You can get acidity, so many problems. I've seen this in my clinic. So we do a personal consultation, look at their lifestyle, mindset, their working requirements. So many people require more food because the work pressure is so much. But ideally, Ayurveda is talking about the ideal condition. So one is a heavy meal around 10 to 11 and a light meal in the evening. This is what Ayurveda says. Okay. So this is a quick overview. Now there is something about the seasons. Now, there are 6 seasons in some parts of India, but most of the places it is not there. Ayurveda talked about 6 seasons. So they are basically shift in the heat, rain, and the cold, these three. So let me just talk about, yeah. So these are the 6 seasons that Ayurveda talks about. The rainy season, then the autumn, followed by autumn. In different countries, it may be slightly different. So we need to create different ritucharyas depending on the place where we are living. Ayurveda has just given one example. Then we have early winter, which is called Hemanta. And then we have late winter called Shishira. In some places, like in Kerala, we don't have winter at all. So, we have only heat and rain. Only two seasons are there, literally. And in between, shades of spring and autumn may come. Then there is spring and summer. So, what we have to understand is during rainy season, vata derangement happens. So, you have to be very careful with your diet. Uh, and there can be many diseases caused by vata. Autumn is the season where pitta aggravates, and kapha aggravates not actually in the cold season but in spring. After the cold season, when suddenly heat comes, then kapha will get deranged. So this is again the ritu cycle. So we have early winter and late winter. So one thing Ayurveda tells us is that our strength keeps fluctuating across the year. We are very strong during early winter and very weak during summer. At the end of summer, our body is most exhausted. And at the peak of winter, we have the maximum strength. But of course, today, winter, pollution, so many other factors have come in. So all these ideas don't hold good. So the last thing is about Sadvrata. I'm not going into that because there is just one more topic to cover. Sadvrata is about, how to conduct yourself in a way, that brings in personal harmony, social harmony, spiritual harmony. This is a very interesting aspect of Ayurveda. It gives you so many advices which are protective. What is the risk of uh, getting diseases due to your social behavior, due to your mental disposition, how it puts you into risky behavior. Like even gives warning on how you should swim when you go to a river, how you should take safety measures, how to avoid wild animals. So all those things which can affect health are described here. Now let me see if I can quickly run through the last slide for today. This is about food. Just 5-10 minutes. So there are three things in Ayurveda about food: is the quality, the quantity, and the timing. Only if you address all these three things, you can have balanced diets. The quality of the food is important. This is very personalized, changing according to the seasons. So you have to have a very dynamic diet. So today the problem is we don't have food intelligence. So much of nutritional data is just today I read about tea and coffee. So yesterday I was telling coffee is very good. Now they are saying tea is better than coffee. And that coffee puts you at a higher risk for stroke. So, that was the question in this article: which is better, tea or coffee? After weighing the pros and cons, it's shifting again towards tea, and especially it should be black tea, not tea with. So today the problem is food has become an industry. Traditional food is interesting because it was created for survival, for nourishment. Today we are making food to sell it to make money. So that is why it is becoming very dangerous. So there is a lot of extremes: vegetarianism to veganism, carnivorism, omnivorism, ketogenic diet, Atkins, and we are all running behind all this without any clue as how it is going to affect your system. So this is the breeding ground, for all the myths about healthy food. So many myths are there, and today we so this is a problem. We want it all in black and white. So Ayurveda never gives you a categorical statement: this is good or bad, as I told you yesterday. So tea, this is a debate. Coffee, all these things. Milk. The problem is that milk, of course, we know, calcium, vitamin D, so many essential nutrients. But there's a new theory going around that milk is actually not suited for human beings, that milk is poison. Now, there are two types of milk depending on a protein found in it, A2 and A1. And A2 protein is actually said to be more healthier. This comes from what you call as the deshi cows. Like, for instance, in India, we have the Gir cow. And what interesting thing is grass-fed cows, which are exposed to sunlight, produce a certain vitamin called vitamin K2. So I like to call this vitamin Krishna, because Krishna was the first person who gave us this idea that you have to graze cows in the grass feed them and put them out in the sun, and then steal all the milk and butter and eat. So he was feeding himself with a lot of K2 vitamin and vitamin D. You know what today we have found is that for calcium to be properly utilized by your body, you need vitamin K2, vitamin D, and calcium, all the three together. If you take a lot of vitamin D and calcium, calcium will go and get deposited in the wrong places. If it gets deposited in your heart, your muscles will become stiff. In your vessels, blood vessels, it will become stiff. But if you have K2, vitamin K2, so some of the good sources of vitamin K2 is fermented soybeans, apart from milk. So in Japan they use a certain type of fermented soybeans which has got a lot of K2. But milk, these desi, that was India's basic source for K. Ghee made out of desi cows, milk will also have this K. So ghee is also so there's certain other things, interesting thing. I'm skipping what is not so important. Uh, yeah, just missed something I was going. Yeah, yeah. See, when we take first morsel, especially in South India, we take a little rice, then we add a little ghee, then we add also some dal. Now, this is an indication that our ancient people were aware of the macronutrients, what we today call as carbohydrates, proteins, and fats. Because the rice is representing carbohydrate, the dal that you add is representing proteins, and the ghee is representing fats. So, by mixing all the three, we are giving an idea that you have to bring a proportion. These macronutrients are actually the key, thing in your food, that is carbohydrates, proteins, and fats. So that is why these were mixed together. And then all the other micronutrients you get from the side dishes. So even without really fully unraveling the chemistry behind the nutrients, they had an intuitive idea of how to balance diet. So food seasons. So one is timing of the meal. So morning meal can be heavy, evening meal should be light. Intermittent fasting I already talked about. So in Ayurveda, we say we have to look at 8 things. This is called Ashtahara Kalpana, how to balance a diet. One is look at the properties of the food. Then look at how you have to combine them. Then look at how you process them. All this will affect the quality of the food. So rice, mixed with dal has a different effect than rice taken alone. Rice cooked in a particular way has a different effect when cooked in some other way. So all these things. So what you have in Ayurveda is the Ayurveda talked about 3 things. Food should be delicious, nutritious, and assimilable. And it is an impossible thing to achieve all these 3 things at the same time. If you make food delicious, it loses its nutritional value. If you make food nutritious, it will lose its delicious value. Some foods just don't get absorbed. So bringing all these 3 things together is actually the science of cooking. So Ayurveda was one of the earliest systems to make cooking scientific by trying to bring all these 3 things together. Then the quantity, individual ingredients and total quantity, the place, time, rules of eating. So there are 8 factors. So okay. So food affects your tridoshas and the trigunas also. That's important. When you eat food, you have to understand how it will affect your doshas, how it will affect your trigunas. Now, what I want to show very quickly is the food diversity. We were open to the idea of having diversity in food, that you should use whatever sources are available in nature. So you can see this classification of food in Ayurveda is quite fascinating. Whatever things people used, all part of the world, they included, they described the nutritional property. So these are all the classification of food. This is almost like visiting a zoo. All wild animals are there here, all as sources of food. From whatever moves or not moves in the world, Ayurveda was looking to see if it has some food value. Somebody somewhere can make use of it. So items are arranged based on the nutritional profile with better items listed first and the other ones low. So this is delicious, nutritious, assimilable. And there are many books on dietetics, many of which have not been studied well. And this would be very fascinating to explore now. There is a sudden interest in Indian, traditional nutrition and cooking, and these are all fascinating sources. Now we have another concept. Hitam is food that is healthy, and Priyam is food that is tasty but not so healthy. And this is a decision that Ayurveda wants us to take. Favor Hitam instead of Priyam. So in our hospitals, our kitchen, we call it as Hitahar, whereas what you see outside is Priyahar. So we have to make a choice here. The next thing is Hitahara is quality. Mitahara, mitashana or mitahara is quantity. Timing is kala bhojana. There is a new concept today called as chrononutrition. And in fact, the Sanskrit term kala bhojana is an exact translation of chrononutrition. The only thing is kala bhojana was the term that was there in the beginning. Chrononutrition is a new term. So these are the 8 factors. So I already described. It's not going. Now there are some interesting things. See, balancing proteins in Indian diet. Most of the time we balance cereals with pulses. So the 9 essential amino acids, especially if you are a vegetarian, you follow this diet, you get a more complete amino acid profile in your diets. You can see across the country, we have this habit of combining. Now with the potato, everything has been damaged because potato is nothing but starch. And now with roti or puri, we are adding potato as the sabji, and we have lost that intelligence because potato is a staple food. I mean, you can use it as a source of carbohydrate. Adding one carbohydrate source with another carbohydrate source doesn't make sense. Our chawal rajma is again a good example of a combination. So in Kerala, we have this puttu and kadala, which is again rice with a. So traditional food intelligence was much more, balanced. And then, sambar, there is a study. This is, it's in a very preliminary stage, but I just want to show the scope of how dietetics can become a new scientific initiative. Sambar, they found in a preclinical trial that it probably has the ability to prevent colon cancer. Now, to put things in perspective, uh, South Indians have the least incidence of colon cancer compared to North India has a higher incidence of colon cancer. Europe, it's much, much more. So maybe there is some reason, some protection from sambar. South Indians are always, eating using sambar in their diet. And but this is very preliminary. We still need to do no more studies. But what is interesting is that food is becoming medicine here. Food is medicine itself. And in fact, sambar is quite impressive. If you look at its nutritional profile, it's quite impressive. Now, in Kerala, we have a dish made of, elephant foot yam, buttermilk, pepper, and turmeric. This is a killer combination because the buttermilk will allow the iron in elephant foot yam to be absorbed, and pepper will allow the curcumin in. So it becomes an anti-inflammatory iron supplement. So you can see food becomes now such a powerful nutrient. So now the last thing is the timing of meals is important. If you eat your second meal before your first meal is digested, it is called adhyashanam. Adhyashanam means eating before the previous meal is digested. This is said to be disturbed. This will disturb your metabolism. Samashanam, eating good and bad things together. We may think that I eat some junk food, but if I also add some buttermilk or some good food, that will compensate. It will not compensate. It is called samasana. And then we have Vishamasana. Vishamasana is having a very erratic dietary schedule. All these patterns are very harmful. And too much less food. Alpasanam is also harmful. So Ayurveda gives you a framework. So I just went very quickly through some of these concepts so that you get an idea how rich this tradition of food and nutrition is. So that's it for today. Thank you. And one word that everybody was fine. Amazing. There'll be one more round of discussion after tomorrow's case study. Today, any questions that anybody has? Please. Basically a framework for understanding how our physiology functions. So all physiological functions in the body have been brought within this broad framework of tridoshas. I gave you an example yesterday of latitude and longitude. Just like we are, it is a construct. So that's what I am saying. I mean, maybe there are other Ayurveda physicians who may have a different opinion. My deep exploration of the concept of tridoshas gave me the idea that this is a framework to understand how you can predict the behavior of any system in your body. Like just like if you have the latitude and longitude, you can create a GPS navigation system. The latitudes and longitudes actually don't exist. It is our imagination. But it creates a framework for us to locate places correctly. Similarly, the Tridosha theory is a framework. I can explain the functioning of a heart, for example. When it is beating very fast, I will say that it is on a Vata mode. Yes, just one. I think this is an important example. Can I request all of you to please settle down, be quiet? Somebody has asked a question, he's your colleague. You will not be able to understand what we talk about. Please maintain some. Thank you. So if the heart is hyperactive, we say now it is showing a Vata dominance. When the heart becomes very slow, bradycardia, we say now it is in a Kapha dominance. If it is shows signs of inflammation and malfunctioning, we tell that it is showing a Pitta dominance. So now any behavior of any organ of the body. Now if the liver becomes cirrhotic, it is a Vata dominance. If it is getting inflamed, it is Pitta dominance. If it starts, getting built up with fatty liver, then it is a Kapha dominance. So anything that happens to any of your organ in the body, within the Tridosha framework, we are able to make sense of it and they get an idea of how to intervene. So a Kapha dominant intervention is needed to correct this organ. That is the way Ayurveda functions. Yeah, I mean, so that is the thing. See, this theory may have its limitation. To a great extent, it is able to cover, and that is why the practice is still going on. Now, any framework will have its limitations. So, there will be some outliers, always certain things that cannot be completely understood by this system. And that is where modern medicine comes in. Like, when you have to go very specifically organ deep, understand mechanisms, modern medicine is definitely able to solve some of the issues that cannot be understood through the Tridosha system. So I don't say it is a complete system that it can predict everything, but it is a powerful predicting system. A lot of conditions. So new disease, this is how Ayurveda today, our community is handling new diseases. All of this have not been described in the texts. Like when COVID came, we understood this as a Vata Kapha dominant type of fever. Because we looked at the symptom, we looked at the profile, how the disease progresses. And Ayurveda physicians were using medicines which are Vata Kapha pacifying, and that was producing results. How will you classify now today's food? Yeah, so today's food, many of them are very kapha increasing, kapha pitta increasing foods. So, like for example, high calorie foods. If there are more, what you call as nutrient dense, calorie dense foods. That is one of the things that we are eating today. So even I was exploring the restaurant here, it's very carbohydrate oriented. I was checking if there is some roti because it has got a lower glycemic index. Rice has a higher glycemic index. So this would mean your kapha will increase very quickly in your system. The second thing is all of them are fried and deep fried. So when you say it's a South Indian restaurant, the problem is deep frying is a big problem. And you tend to use the same oil again, it will aggravate pitta. So you will have inflammation in your system and you will have accumulation fat because the excess kapha will get converted into fat. So we can assess that.
Sir, what about fruits at night? Like there must be some, like you said, that time and.
But it depends on digestion. Actually, in Ayurveda, we have the hot cold concept. which I find is a very unique framework that traditional system gives. It's very intuitive that when you eat a very cold, like citrus fruits in the night, if you are already having a tendency for cold and cough, then you will see it will aggravate immediately. So all fruits are not harmful at night. Like for example, pomegranate, it will not cause any problem at night. But if you take citrus fruits, if you take it on empty stomach or if you take late in the night, you can see that it can either, sometimes it can cause acidity or sometimes it will cause some phlegm in your system. It may make your throat irritable. So there is no general rule. Everything is different. All fruits are different.
Sir, and like you explained about how the three doshas work, how do the three gunas complement them? Like they are also affecting the well-being of the person.
Yes, yes. See, the thing is, there is both of them are working at two levels. The
What is exactly three gunas?
Yeah, trigunas are actually tendencies of your mind. It comes from tridoshas are of the body. So tridoshas are more like your reflex mechanism. Like for example, if I have more of vata in my system, my first response to a situation will be triggered by your tridosha. But if my mind is active, the second conscious response will come from the trigunas. Like I'll put things in context. Now you are a vata person physically, but mentally you are rajasic. Imagine. So what will happen? Vata will give you that fear response. And it will be amplified, even consciously your mind is rajasic. So it will amplify that fear response. And actually you will have an exaggerated fear response. But if your mind is sattvic, even though physically your body gives you the first reflex fear, the next moment your mind intervenes, it will nullify it by the sattvic response. So if you are a vata person and sattvic, you will have more control over your fear. Whereas if you are in both people, fear, that innate tendency for fear cannot be eliminated because both are vata persons. But one is sattvic, means he will be able to control his fear. One who is rajasic will not be able to control his fear.
Times of the day that correspond to mental state.
Yeah, mental states. Actually, the morning is sattva and vata. So that is why it's good for intellectual. Vata is, brain activity. Evening is tamas and vata towards evening as you go down. So by evening you become tired, get exhausted. So morning is kapha and sattva. So you have a lot of energy, mental and physical energy to work.
It's like predicting the mind states according to the day.
Yeah. So generally it will be there, but then each individual lives life in his own way. So you can aggravate your gunas or doshas at any time of the day. I mean, you can be rajasic at night also, if you stimulate that. But this is the external influence. So what Ayurveda says, if you can align yourself with these cycles, then you can live your life more in a more efficient manner. Otherwise, you get into conflict. So, yeah. No, see, this kind of intense exercise when you are doing, it is a different thing. If you are following a regular health cycle, the morning exercise is enough. I was also reading recently about the debate between when you should exercise in the morning or in the evening. Now, those of you who are working for sports, that's a different lifestyle altogether. Your food requirements when you are working as a sports person will be, this lifestyle that Ayurveda has given is for the general public. Now, depending on, that's why I said it has to be very personalized. If you are going to be a sports person, or if you are working in the military, or you have certain other demands, then your lifestyle has to be adjusted. Now, if you uh, exercise mildly in the morning on empty stomach, there is no problem because it will activate your digestion, it will pump your heart, and your metabolic rate will increase. and actually it will help your body to burn fat throughout the day. So morning walking is actually good. So evening walking is mentally more refreshing, relaxing after a very tiring day. Walking in the evening or exercising in the evening can also be refreshing. But the thing is, it's both have its own pluses and minuses. Now, one important thing in Ayurveda is if eating heavily before physical exertion is not recommended. Modern studies are also pointing to that. That after eating, taking a mild walk is very good. It will ensure that your sugar levels don't suddenly spike in the blood. So there is an old sloka in Ayurveda, Bhuktoba Vishadastandra. If you sit immediately after a meal, you will become lethargic. Shayanasya rujastada. And if you sleep after a meal, you will become sick. You should not sleep immediately after a meal. It will lead to all kind of metabolic disorders. Ayush chankramana manasya. If you walk after a meal, your lifespan will increase. And mrityur dhavati dhavata. If you run after a meal, death will come running behind you. So it should not do any heavy exercise after a heavy meal. That is the Ayurvedic concept.
Even in general life, although in Haryana, like in village of Haryana, we follow a lot of Ayurvedic till now. Still, we eat around 5 times. So we will have morning meal, then we will have fruit around 11, 12, then we will have lunch, then we will again have fruits, then we will have evening. So
True. See, that is why I was telling that Ayurveda does not tell you that everybody should follow the same thing. This is a general, see, the ideal thing when everything is working ideally, this is the way you can eat. But there may be some reasons why in certain regions, certain lifestyles. See, it is your diet. Can everybody be please quiet for some time? See, diet should be according to the lifestyle. So that was there in my slides. There are three types of lifestyles. It's called Laukikam, Vaidikam, and Karmapavarga. Three types of lifestyles. The Laukika lifestyle is our lifestyle, where we are leading an uncontrolled life. Just going behind enjoyments. Our energy requirements are very high. We will need to keep feeding ourselves to be stable. So, if you are leading a very Laukika life, it will reflect in your meal plan also. You will need more frequent meals. A Vaidika lifestyle means you are going to the next stage where you are trying to control your life, you are trying to lead a healthy life. So, there you will be able to regulate your meals. You may need, your energy requirements will become less because you are less stressed, you are following a healthy lifestyle. Third is Karma Pavargi. This is kind of an ascetic lifestyle where you are doing a lot of meditation, mental practices. Then your food requirements will become very less. So, what Ayurveda, what we do in our practice is we look at their cultural background, we look at their geography, we look at their lifestyle, then make an assessment of what is your energy requirement. Is that clear?
what's the issue? What is the issue? Is anybody waiting for the proxy with the attendance sheet? Anybody waiting for that? No, right? Yeah.
Um, from all the discussions, it appears that there is a lot of talk of the Western system within this. For instance, this whole advocacy about sugar being the devil of the piece, villain of the piece. Now, we are talking the same thing. So, how are we ensuring that the soul of Ayurveda is not contaminated with Western? While this is one discipline, very pure and traditional and rich in itself, in the name of evolution, uh, that's one part of it. I mean, it's good to evolve and it's necessary also. It's vital, but at the same time, it has its own identity and value. One. Number two, there is little
they are taught the food pyramid. They know all about the nutrients, but they know nothing about the mind-body connection. Why is there no advocacy at school levels about our own traditional systems? I mean, even if it's in small measures, at least they know that my mind will be affected if I eat this. That's one part. Think about how we travel and the food and the crap that we eat on airlines. Why can't there be a mass movement to say all airlines will serve food which is based on the principles of Ayurveda? For instance, I mean, it need not be very hard line listing approach. But there are so many things that as a country to advocate the discipline because of the value it brings to the world, there's so much that needs to be done. So are there any people, are there any agencies that are doing that, or we have no clue? I mean, this is the first time I'm hearing about it.
Yeah. No, I think it is just begun now since the NEP 2020. There has been efforts. I've also been part of a curriculum area group creating content for NCRT. So one of the ways is to long back I was involved with the CBSE. I'm just talking about what I'm aware of the efforts. And we brought out two textbooks for 11th and 12th elective courses called KTPI, Knowledge, Traditions and Practices of India, where the students would be introduced to these ideas, the whole spectrum of the IKS knowledge systems. So that was at that time as an elective course. And it took a lot of effort to get that introduced into, CBSE. This was, 10, 12 years ago. Even the government was not so favorable at that time. Now there is a big effort going on to integrate this content into the NCRT textbooks, but we have been facing a lot of resistance. It is not easy. So this main issue is that how scientific is this content? Has it been validated? So everything needs to be, looked at within the framework of the Western knowledge system. So see, many contradictions are there. Now, modern science would tell us that curds is very good. Now, Ayurveda will say it is not so good. You cannot eat curds every day. Now, there is a contradiction in the nutritional concept. So now the modern nutritionists are opposing that you cannot teach children that curds is not good. So what Ayurveda says is not that curds is bad. It has got a lot of nutritional properties, agreed, but you have to exercise some caution on how you use it. In certain conditions, in certain health situations, using curds can aggravate that condition. So that is, we know intuitively also, when you have a fever or a cold, when you eat so much of curds, then, phlegm increases. So this problem is there. There are now honey, according to Ayurveda, is good for even diabetics, but today modern nutritionists don't agree with that. In small quantities, because honey has fructose in that. Fructose in higher quantities are harmful, but in small quantities, it's easily metabolized by the system without causing a sugar load. So we are also forced to sometimes explain these things in modern framework, otherwise there is no communication happening. So there are challenges. So I think we need forums like this, opportunities like this to create more awareness. Once the larger intelligentsia of our country become aware of it, then only there will be a change. At this point of time, it is marginalized. There are just few people, few individuals who are aware of it, and it has not reached the masses. So when there is a mass awareness, I think there will slowly a change will happen. At least in the last 10, 15 years, in the last few years with this IKS initiative, I'm seeing that there is much more momentum and more awareness and more penetration. So I am hoping that, we can build upon that and take things in the future. Having said that, I'm also very critical of our tradition also. I don't believe that everything in Ayurveda or our tradition is the ultimate thing. I mean, I am looking at a meta framework, a multicultural framework where we can learn from the experience of all cultures. Modern science has its advantages and its strengths, and we shouldn't get into a conflict between tradition and modernity. And I usually look at both frameworks and try to understand, because ultimately what is good for the human being should be promoted. The whole idea of bringing IKS is to enrich our lives, bring back elements that we are missing because we got stuck with one universal framework and we are losing other perspectives. So I think that is a healthy way to look at it. There are many things in Ayurveda that may have to be revised. There could be errors also, and we are open to that. But in many areas, Ayurveda gives you fresh perspectives, new avenues for research. So we have to discover that. So that's why I mentioned about Kalidasa when he says, Purana Mityeva Nasadu Sarvam. Just because something is ancient doesn't mean that it is right, and something which is new. So Kalidasa was one of the earliest thinkers to bring the conflict of tradition and modernity into a right and healthy perspective. And he said, examine and verify yourself and then accept what is good in the past and what is good in the modern. Both have to be integrated. So we are in that stage of seeing this confrontation between tradition and modernity, and I think we have to navigate very carefully. And our goal should be the good of humanity, the well-being of humanity, rather than sentiment. Just because it's Indian, just because it's Ayurveda, it should be right. I mean, I don't think that is the right approach. So if it's going to help people live a better life, achieve greater fulfillment, then we should promote it. Otherwise, it should be not encouraged.